I'm Ed and I live in Scottsdale, Arizona. I work in the transportation logistics arena. I had symptoms that occurred over, I'd say, the past 5 years or so. They were there, and I went and saw a urologist when we lived in Denver. He said, just keep an eye on it. You have an enlarged prostate. And then we moved to Arizona. And then right before I knew I had to do something, it got really intense. I was having a hard time urinating. And then one day, I couldn't urinate. I had to go to the emergency room. So that's when I knew I was in trouble.
So Ed is one of the early patients that I treated with Urolift. And he came to me in a terrible situation where he could not urinate at all. And interestingly, it came on fairly suddenly. He had had very little in the way of urinary symptoms. He had not that much nighttime urinating. He had not that much frequency during the day, but all at once he couldn't pee at all. And he had to go to the emergency room, and he had a catheter put in, and he was started on appropriate medications, and the catheter was removed and had to go back in again, and then removed and went back in again. And he simply did not want to live with a catheter.
We tried different things. He tried drugs at first, and I'm not a drug guy. I don't care to take drugs, but I tried it. Didn't work. Dr. Jaffee said, we need to do something else. It's not working. And then he said there's a new procedure that's recently been approved in the United States, and that's Urolift. Well, the procedure was very quick, in office as an outpatient, and seems like it took about an hour. And I was out, came home. Then after that, it was a gradual improvement process, and I continued to improve for several months, actually, and it's been great ever since. So, very pleased.
The introduction of Urolift 2 years ago really changed my whole approach, because I'm seeing much greater improvement of symptoms and of objective studies with Urolift than I can see with medications. And they are having fewer side effects. A great number of my patients seeking treatment for their enlarged prostates care about their sexual function. And Urolift sets itself apart from all of the other treatments because it does not have a negative impact on sexual function. There's no change in ejaculation, and erections are not impacted by this procedure. The reality about BPH is that most of the patients that are suffering with the symptoms are in the Medicare age range. And Medicare has been very good at covering the Urolift procedure. In my experience so far, I have seen patients that have done so well with Urolift that I really believe it's going to be the answer.
I would say treat it early, and I would not hesitate to have this procedure, the Urolift procedure, done. It was excellent.